I'll start again. Welcome, everyone.
Welcome to you.
Yeah, and to the Adult Social Care, Health and Communities Overview and Scrutiny Committee on the 14th of October. So you're all very welcome, and I'm welcome to Vicky and Jane and
Kevin Fagan.
Kevin, yes, I should know that. Yes, so you're all very welcome, and we look forward to your contribution through the evening. Can I ask Democratic Services Officer, apologies?
Yes, through you, Chair. We have apologies for non-attendance from Councillor Fiona Baker and from Councillor Adrian Cartwright, with Councillor Ronald Furman substituting for Councillor Cartwright.
And you're very welcome. Good. Okay, item 2 is declarations of interest. Any declarations of interest that we need to declare for this meeting? And we can pass on to the minutes of the meeting that we held on the 2nd of September. Are they a correct record of our meeting looking at health issues that we looked at last month? So, yes.
I can't actually see you because I can't get connected, but I want
No.
to make sure that...
I just wanted to make sure that the comments that Councillor Baker and myself made to the health service about the changes that they were, it was the pilot scheme for introducing more appointments, but those appointments wouldn't necessarily be with the doctor. And I said that I felt a significant change like that would need a public consultation, and I wanted to make sure that that comment was properly recorded, because they did say they go away and check.
Right. Shall we record that in the minutes for tonight, or as an addendum to the minutes tonight, and we can go away and check what the outcome of that was? Yes.
I mean, I understand that it's great having more appointments, but the public should be aware when they are making that appointment, if they're not being offered an appointment with a doctor, they should know that that is the case. And if they're willing to take another appointment, that's fine. But if they believe their condition is so serious that they need to speak to a doctor, they should be made aware that they need to ask for that. Thank you.
Yes, thank you for that. With that note, can I sign the minutes as a correct record of that meeting? Oh, I need a pen. All right. Where's the 14th?
Yes.
Thank you. So, on to my announcements, which are that we are being webcast on YouTube. Therefore, we all need to speak into the microphone, which I might even remember to do as we go through the meeting. We're not planning any fire drills this evening, so if the alarms go, we will follow the Democratic Service officers and their instructions. And shall we make sure that all our phones are on to silent mode before we go any further? He said, thinking, I don't think I've done that. So we shall, yes, we're on silent. Good. Okay. So I think we're now on to the kind of one of the two main items for tonight's meeting, which is the annual report from the Community Safety Partnership. And I think this is a statutory duty that this report has to come to this committee each year, and we get an opportunity to look through it as one of our duties on this committee. So, Jane and Vicky, fire away.
I'll start off. You stole a bit of my thunder there because I was going to say that. But just to say, the Community Safety Partnership, it has been set up as part of our statutory duties. It's a collective approach by a number of the agencies within the area. Ours covers West Northamptonshire only, but it includes as the statutory authorities that have to take part is West Northampton Council, Northamptonshire Police, Northamptonshire Fire and Rescue, Probation Service and the Integrated Care Board. But then we also have other delivery partners on there who also contribute, such as Northamptonshire Healthcare Foundation Trust, Office of the Northamptonshire Police Fire and Crime Commissioner, Youth Offending Service, Voluntary Community Faith or sector organisations, but also people like the Children's Trust and some registered providers as well to support us with the work that we're doing. As you said, this report is an annual report that needs to come to scrutiny to be reviewed under the crime and disorder regulations. So that's as much as I'm going to say. Then I'm going to hand to Vicky to give you a bit more of the detail of the report, if that's okay.
Thank you. So I suppose, so James gave a bit of background in terms of statutory partnership, statutory partners. So one of the statutory duties that we've got is to put together a community safety strategy for West Northampton's local authority area on how we are going to reduce crime and disorder in our local area. So we have a statutory duty to do that, and we refresh that every year. And the paper talks about the current priorities, and of which there's 4 of, and we get those priorities through a number of ways. We rely on the data that comes through the police's strategic assessment, through data of our own, through data from partners, through insight from the community. So we regularly engage and talk to the communities about, what are the priorities in their neighbourhoods, and we do that. We do that with the police. We've got a team, we've got a community safety team, and we're very much aligned with local neighbourhood policing. We have some of our officers are based in the police stations, and have access to systems that are also used by our police colleagues. So we do have a really strong working relationship in our neighbourhood. So the current strategic priorities for the Community Safety Partnership, creating safer neighbourhoods for all, tackling serious violence in all its forms, so including domestic abuse and knife crime, safeguarding vulnerable individuals, and early intervention and prevention to ensure that we're addressing the root causes of crime. So just generally the report, it's good news. I think the fact that we've seen an overall reduction in crime of 1.8%, on reported figures across West Northampton, I think is significant. Even more significant is the reduction in violent crime. We've seen an 8.1% reduction, which really is significant given that we saw a significant reduction last year as well. So it's a year-on-year reduction. And in Daventry and South Northampton particularly, crime fell by 3.6%. And in the Northampton sector, we saw a fall in crime of 0.9%. So it's important to talk about the good things, but there's also challenges. So it's not all perfect. It's not all rosy, and this is based on reported incidents. We do spend a lot of time and we do work as a partnership to try and increase people's confidence in reporting things. It's one of the first things that we go back to people and say, have you reported it to the police? Quite often the answer is no to that. So we will encourage, the use of things like Crime Stoppers, which is anonymous, because some people don't want to report due to the fear of reporting. So there are other ways that our communities can report, but that's always what we go back to first. Have you reported it? Because unless it's reported, resources can't be deployed effectively. So there are some challenges. The paper does highlight a few of those challenges. We've seen an uplift in shoplifting. But that was mainly due to improved reporting, and that is now actually stabilising. We've seen an increase in both areas around rape offences, specifically around domestic related. We've seen a rise in residential burglary in some of our rural areas, but we've seen a lot of targeted activity around burglary, and when we see targeted activity and resource, we then often see an increase in the crime. So a bit like the retail crime work that we've been doing in the town centre, and we've also seen an increase in antisocial behaviour. And I never measure that. I never measure antisocial behaviour and increase of antisocial behaviour, because I think there is something around us wanting to increase people reporting antisocial behaviour. So some crimes we're looking for an increase where there might be a lack of confidence, particularly public confidence. Antisocial behaviour is definitely one of those areas. There is a whole load of initiatives in there which I don't intend to go through, but Kev's laid out the report really well in terms of what does the performance look like, a kind of overview of what our priorities are, and then some of the activities and actions that we've been taking as a partnership. It isn't everything. It certainly doesn't reflect the whole amount of work that's been going on, but it just kind of picks out some of the key things that the partnership have been doing over the past 12 months. And I probably also should have pointed out right at the start that it is a 12-month report, so we were talking about last financial year in terms of the report and timescales. So actually, this is up to March 2025. So we are, 6 months on, aren't we, from that time? So it's important to recognise that, because obviously things shift and change, don't they? So a couple of things to just pull out, a couple of highlights really around some of the great work that's been done. I have to mention Operation Fragment, which was focused on in the Daventry area around issues that we had with regards to antisocial behaviour, primarily young people, bless you, primarily young people causing antisocial behaviour in the town centre, and there are also other concerns around kind of links to drug activity and violence, increase in litter, and some other issues as well. And Op Fragment really was partnership activity at a real local neighbourhood level. So it involved getting all of the local partners within that space together. So town, council, youth organisations, the police, health, everybody that's kind of got a stake within that area, and actually together looking at what can we do to improve this area. So an environmental visual audit is usually carried out. So that's a walkabout, the estate, noting down what are some of the things that we could do to improve this area, and then an action plan's produced, and it is a multi-agency action plan, so it's about everybody doing something in that space to improve it. And we did, as a result of kind of working in that way, working with the communities, and that's really the key, working with the community, listening to the community, knocking on doors, being approachable to the community. We saw a huge reduction in antisocial behaviour and crime in that specific space, a reduction in fly tipping, and an increase in reporting and public confidence, which is absolutely what we want to see. And I say Op Fragment, but it kind of follows, a way of working, and that is how we are working in our neighbourhoods around community safety. So, where we identify particular areas that are causing us antisocial behaviour or, an increase in violence, we will work at a neighbourhood level, and we'll do that between the community safety teams, internally our community safety teams and our community development teams, but also externally with external partners. Hopefully people have seen or heard of our 2 antisocial behaviour engagement officers that are working in the town centre. You might have seen them with vests and the high-vis jackets. They've been with us for about 6 weeks. So the next report will have a really good, kind of overview around the work they've been doing. But they are monitoring every engagement, every interaction that they're making. And we have had some really good feedback from members of the public in the town centre and also the businesses and the market around them being a visible presence in the town centre. So that's just something that I wanted to mention. Again, early days, but something for the next report, and it would be remiss not to mention that. I just also wanted to pull out the contextual safeguarding meetings that we do with our schools. So primary schools and secondary schools are designated safeguarding leads across those schools. We have a network in the rural areas, Daventry and South Northants area. Or no, it's not all rural, but Daventry and South Northants side. And then we also have one in the Northampton locality where we bring those designated safeguarding leads from the schools together. And Debbie McCall, our serious violence reduction coordinator, chairs those meetings, and they are proving to be a real success with the schools and a real key way for us to engage in schools. So two-way conversation around, what are some of the priorities and issues that we're seeing, but more so for schools to be able to feed back to us, to tell us what they're seeing in the schools, what's happening in those neighbourhoods. Schools are communities, aren't they? Part of the community, a big part of the community. So we're really getting some good feedback around what's going on in the schools and where they're feeling they need support. We're able to support them. So I say our serious violence coordinator leads that, but she's doing it in partnership with our education team, and partners like the police are attending that, and others as and when. So I just wanted to mention that. And whilst we're on kind of schools and education, the Pol Ed, which covers PHSE subjects, is something that the Serious Violence Partnership is rolling out to all schools. So we've got 41% of primary schools are signed up and 45% of secondary schools are signed up. So we will continue to push that. But that is a range of subjects, kind of community safety subjects that are available, a resource that's available for schools. It's really good because the information's consistent. It's a national, it's part of a national programme. But we've been working really hard with partners to try and get that into schools, and we're nearly halfway there, which I think is not that bad, and it's going to continue to be a priority for us. And it complements our Young Citizen Days. So we are on the first day of Young Citizen for our Daventry and South Northants locality area, which is where we bring Year 5 and Year 6 students together for a day, and we do face-to-face. We cover face-to-face subjects. So it will be around issues like exploitation, online safety, hate crime, personal safety, water safety, rail safety, a whole range of subjects, and it's a mix of kind of stage performances and drama and interactive workshops to and the children and young people just kind of move around the spaces. But it's a really good way for them to learn, and we always get really good feedback from the teachers, don't we, and the schools. And we prioritise, as well as Pol Ed, we kind of prioritise those schools based on things like we've got higher crime rates, for example, given that we are a community safety partnership and we are absolutely data and intelligence and community insight led. I could literally talk to you all day because there's so much stuff going on, but I won't. in case we run out of time for questions. So I'll leave it there. You know, as I said, hopefully people have had a chance to have a look at the report. There is so much going on. We've got a really good community safety partnership. It's a really well-established partnership. And, you know, partners that are coming together regularly to really tackle crime and antisocial behaviour across West Northants, and you know the performance results speak for themselves in terms of some of the the real successes that we're having as a partnership. So our intention is to continue to build on that, strengthen that, work with our communities as we roll out the local area partnerships, and how the community safety partnership fits and sits with those is an absolute priority for us. And we just want to continue to do the great stuff that we're doing. Kev, is there anything else that you wanted to pull out that I've missed?
I think you've hang on, am I on? I think you've captured everything. The only thing I would say from the report is that we reference at one point something called a most similar group, and there's no context in the report for that. So just to let members know that is a Home Office tool where they look at various factors and put different community safety partnerships in groups together where they feel there'll be a useful comparison. Because otherwise what we compare ourselves to. Before we were West Northants, if we were running Daventry and South Northants Community Safety Partnership, you couldn't compare it with Corby or Northampton because obviously the crime is considerably lower. So we can compare them with the data for Daventry and South Northants sector and for Northampton sector with similar CSPs. So when we refer to the performance against the most similar group average, so even though, like, for instance, shoplifting is going up because of the Retail Crime Initiative, we're still considerably below the average for our comparator CSPs. So it's a useful one to know on that one. But I think, as Vicky said, hopefully it's been comprehensive enough and we'll take questions.
Right. Can I just start the thing by kind of the difference between using reported crime as you do and the British Crime Survey, and does the British Crime Survey, how do we compare with what the British Crime Survey might be suggesting to us, and what the difference between the two is, and whether that's important for us to kind of hear?
Yes, I'll take that one. We do, once a year, I also run those figures along with colleagues from police, and it's broadly indicative that the figures are the same, broadly the same. If you like, Councillor, I can do that for next year's report, and we'll actually put the two together for you. One of the things that we say, Vicky was quite right in saying this is reported crime. Now, certain crime types will always be reported. If your house gets burgled or your car gets stolen, you will report. Because otherwise you can't make a claim. It tends to be violent offences and sexual offences where we don't necessarily get a report, and so that's where a lot of the work comes in terms of where are we with that. So, for instance, we're reporting a reduction in domestic flagged violent offences, but our colleagues in the sector who are working with women and men in refuge are saying that their workload has never been higher. So we're very cognizant of that. And then there's a question for our police colleagues in terms of where is the trust and confidence? Where's there an issue there in terms of people are experiencing issues but not reporting them as crimes?
Is it worth it, just to pick up two issues there? One, and I'll come to you in a moment, Rosie, but I'm on a roll. I mean, the two things were, one is that when we've met with our local police inspector, and I was just amazed at the number of initiatives they had going on. So although our crime rate has gone down by kind of about 1%, 2%, 3%, beneath that, there is an awful lot of paddling going on and really hard neighbourhood work by the police teams with I don't know, 15 initiatives in central Northampton, something like that. So I think one needs to recognise that for it to be kept at the level and going down, there's an immense amount of work that is going on, and we need to keep that going, because if it doesn't, I think it will start to rise again. And the second question is, certainly when we have residents' meetings, people their perception is that it's difficult to report crime, and how we get that over to people that actually there are a number of ways of reporting, and for example, where we have local issues, emailing the local PCSO is often a very good way of getting that local information into the police, who then react. There is and you know, using the online system is probably as good a way as any. And you know, and as a ward councillor, I've even emailed the inspector and had a response in kind of 20 minutes, you know, so where I've thought this is something that's serious. So I think it is, how do we get over to the public it is, you can get information through to the police and they do respond to it. And whether it is that people don't always use the right method for the right incident, there is, you know, that seems to be one of the challenges we've got.
Yeah, and I think that's the biggest challenge. And actually, quite often, I mean, you deal with a lot of member inquiries, but also, you know, inquiries from the community, and I always will promote the online form. I'll send the link for the online form for the police, because, you know, you ring 101 or people ring 101, and however long they're waiting for, by the time they've spoken to somebody, you know, there's frustrations there, isn't there? If it's a non-urgent crime, then I always think the online system is much better, and it's also recorded, you know, in terms of, you've got a bit of a audit trail, you've got a crime reference number if it's a crime, and someone will come back to you. So we spend so much time on encouraging the community to report, and it's always the first question. I started with that, didn't I? But you know, as councillors, as elected members, you know, absolutely, please support us with that. Encourage, you know, community members to report. They don't have to report online. They can ring 101 if that's what they prefer, or through Crime Stoppers if they want to remain anonymous. But I think, you know, there is something around, if we don't know about it, we can't do anything about it. So it's so important that people report, and the more we can see that's happening, the more resource goes into that space, because you can see that there's an issue that's been identified.
Sorry, can I just add to that as well? I think the other thing to remember, and you made a really good point there, Chair, in terms of keeping the numbers down becomes more difficult. We are in a world where things have become much more complex. People have more complex issues. It's getting more difficult with community tensions. There is a lot more that we are dealing with on top of what we've had in previous years. Cost of living crisis has forced people into certain routes. So I think remembering the work of the CSP that's been done alongside of that and trying to keep those at those levels and reducing crime is probably harder than it's ever been. And I think the other part to remember is there is also perception to remember as well. So some people don't feel safe, even though they might be safe or crime might be lower. That isn't how they feel, and that's something that we really take seriously in that community safety partnership, about how do we address those perception issues, how do we make people feel safe to walk our streets, to use our facilities, to use our town centres. So that's a really key part of this.
Thank you. I was really interested in the work that you're doing with young people, because towards the end of the last session we were getting reports from the young people around our secondary schools that they would really welcome a presence at going home time. There isn't a problem going to school. They're all too tired, just got up. There's not much crime going on. But it's when they leave school, and the schools particularly, and of course some of them are run by us, but a lot of them now are academies, and they don't want to have any police presence because they think it puts them in a bad light. But the young people would really respect, even if it was a volunteer service, just that 20 minutes of walking home, because a lot of them, particularly the young ones that have only just come up, their parents aren't around, they're going to empty houses, they've got to have a safe walk home, and the bullying and intimidation and pinching phones and all of that stuff, that's when it happens. And I listened to a programme on Radio 4 about how they were reducing crime in an area in London, and they said that they'd measured it, and if it was once in 5 times, therefore once a week, but you didn't know which day it was, that was enough to maintain the low level, the risk that you might, if it goes on for a fortnight, they think they're safe. But if they're not sure, oh, is it Tuesday? Did they come Tuesday? So have they just been on Monday? It's enough to actually deter that low-level crime. So I'd be interested to know when you talk to your young people with the youth forum, but it's particularly in my area in the rural south that we think that there's an issue, and certainly Chenderit have asked for it. But also Magdalen were the ones that were resistant in case, it looked bad and people didn't want to send their kids to school because they thought there was a problem. But I think we've just got to be realistic. I don't think we should be asking permission of schools anymore, because once those kids leave that school gate, the school doesn't want to know.
Absolutely. It's a vulnerable time, isn't it? And you can totally understand, can't you? Even more so where you've got secondary schools that are in, real close proximity of each other. There are some really good schemes out there. School pastors, which is kind of street pastors, but instead of street pastors, it's school pastors. And it's about capable guardianship, isn't it? It's putting appropriate adults in a space. And you're right, it doesn't need to be the police, but it's something that we could work with our community voluntary and faith sector around and see if there is any interest. It is something I've looked at previously where we've had particular issues, but if young people are raising it around that presence, it'd be really good, wouldn't it, to be able to kind of respond directly. So perhaps it's something we can take away. And
I think Chenderit are game for it, and maybe if we could make it successful somewhere, we could coax the other schools into being. I mean, let's face it, the death of a child that happened that time coming out of school, didn't it, when that child was murdered. And I wondered whether the government's initiative, I've heard of them talking about having metal detectors in all schools. I don't know whether you've heard anything about it.
Nothing's been confirmed around that. I think there is something, isn't there, around engagement. I mean, it would be really great, wouldn't it, to have youth provision, being able to offer that kind of on an outreach basis. But I think, if we look at the community and voluntary sector, and school pastors very much works on a voluntary basis, so if we could start somewhere small, test it out, see if we can get some volunteers. I mean, it's a really good project for the school as well, isn't it? Because it also supports the school, because some schools will have the teacher standing outside, won't they, and kind of on the direction of travel home. But actually, if it's coming directly from the young people, that is what would make them feel safe. There's some conversations, I think, to be had with the schools, and perhaps we could do it through our schools' contextual safeguarding meetings around young people are raising that feeling of safety during that time. What are the schools doing? And perhaps we could get a conversation.
Okay, thank you.
Thank you, Chairman. I'm working blind because I can't make my computer work. So will you forgive me? I think there's several things here. We do this, you say, once a year, endorse.
The report,
I think that what would be a very good idea would be to give us, particularly in the rural south, a report that we can communicate to my 31 villages, to Rosie's, so that we know that you are invested in rural areas. I'm not saying you're not. I'm not saying that your heart isn't willing, but the people who are on the other end of the trough feel that they're very much left out in the cold. So we do get reports that we, as members, elected members, because then pass on to our parishes, and then it feeds down or runs down the food chain. And I think if we could do that, we would make people feel convinced. Even indeed if you did it once a year now and in 6 months' time endorsed your report. or any new findings that went with it. Not that you have to report to the whole board every year, more than that, but it could be done. I think also, I totally agree with Rosie. It's on leaving school that these kids feel insecure, and we need to do something to endorse it, not only for them, but for the parents, because as we say, from 11 to 18, these are latchkey kids. They walk home to what? And if you know about the car park at Chenderick, there are people who wait to jump and pick up those that look lost and confused. And if we had an adult presence, it might endorse the safety factor. The other thing that really gets my goat is that I do think that if the government would bring in a metal detector, this knife crime situation, I should think it's awful in Northampton. It's beginning to creep into the rural areas. Thank you.
Thank you. So just with regards to the reporting, clearly this report comes to scrutiny once a year, but we report on a regular basis. So I'll let Kevin come in a minute and tell you where that's shared, etc., so where you can access it. But with regards to any other kind of key items, for example, like the domestic abuse strategy that comes to the Community Safety Partnership, we also bring that here as well. So whilst you get this reporting once a year, you get different elements of what the work that we do in the Community Safety Partnership coming through this. And I think that the second thing with regards to the safety factor, there is nothing to stop us. We don't have it on the forward plan at the moment, but we could bring in an overview of the work that is happening around that youth area just to give you a bit of a look and allow you to input, which I'll work with Vicky and Richard to put onto the agenda later on if that's what the Scrutiny Committee wants. Kevin, do you want to give a bit of more of an overview where you can find it?
Yeah, this report is based on a report I produce the CSP board every quarter, and that is then posted onto the website. So we're updating this on a quarterly basis, and on the Community Safety Partnership Achievements page of the website, you'll find those reports being updated. I'm just looking now, so we've put the whole report on, and then we'll do some headlines on as well, so you've got that. And when I do the quarterly reports, I also break things down by ward, so you can actually see the crime figure change for each of your wards. So it's not just a question of overall for West Northants or overall for the Daventry and South Northampton sector or the Northampton sector. It actually take it down to ward level as well. So you'll find that on the web page.
We'll share the link.
That would be very helpful. The difficulty is that some of us have very broad bases to cover, and I'm not asking to be spoon-fed, but to remember every quarter to go back and check, to then roll it out to our constituents, is we trip over ourselves.
We could put it, couldn't we, a reminder into the members' briefing with a link.
That would be excellent. It's not because I want to be spoon-fed. It's just that sometimes you get so carried away on other issues that this is one of them that you don't pay attention to. The other thing is, do we go on to the older generation at some stage?
Yes,
Yeah, I want to.
Yeah. I'm going to go to Andrew. I'm going to go to Andrew because you've been waiting patiently.
Yeah, thank you, Chair. I've got a couple of points I wanted to make, really. And I think you touched on it by mentioning the British Crime Survey. The continual issue seems to be this is really great stuff in this report, and the figures are going generally in a good direction, but the public's perception is often very different. And I'd use that to illustrate a situation in my own area in Bournemouth and Crick, where we have the Ibis Hotel, which has been used for asylum seekers. And obviously there was a load of issues over the summer, or supposed issues over the summer, that were coming out in that area, and the public were getting a particular perspective, a wrong perspective in many cases, on the levels of crime and antisocial behaviour there was in that area. And the police were brilliant with working with myself and my colleague and the parish council, trying to calm things down and to put things into perspective, but you still, I particularly was getting very angry by looking at social media and seeing lies and misinformation about the crime figures in the area going out there, and yet I'd been speaking to the police inspector, and he'd actually said that the Ibis Hotel had seen a reduction in crime since it has been used for asylum seekers. So I just wonder how we try and counteract that better, because I know you can't be all over social media. It's very difficult, but it is putting out there misinformation and lies, which is making people scared when they shouldn't be, which is then causing further issues in the community. So that was my first point. The second point, really, and it was relating to that incident, really, was that we were encouraging people to try and report stuff through the online reporting, the non-urgent reporting. And the information I was given was that is helping build up the picture of what is actually happening in there, giving intelligence more to the police about what people are experiencing, which is great, but there isn't any feedback that comes out of that. So it's difficult when you're going to, as a local councillor, when you're going to meetings to say, please report it, please report it, please report it, but not having any information back to say, people are reporting it, we've had X this is what the real picture is. So I think there's a gap there in that information, which again is about hopefully giving the public a better view of what really is happening.
Yeah, and everything you've said, I absolutely agree with. It's so difficult, isn't it? Because we'll do we could do a press release following today around kind of reduction in crime figures, and then hope that would have a positive positive impact on people's perception, and then something nationally happens around crime, and actually everybody's impacted again, aren't they? In terms of how they feel, and it is really difficult. Like, misinformation is really difficult. And again, the resettlement team are in my service, so I was at the heart of that. And it's funny, isn't it? Because you hear something, and I do it with my own children, and I'll delve into it. And the first thing, where did you hear that? I ask the question, and then they come back, don't they? And I'm like, but do you actually know it's true? But they are the questions I think that we have to start having in our communities around actually, when you're hearing people say crime is going up, it might be from a national news article that you've read, but actually it isn't in West Northants. And I think we've got to go back, haven't we, with some of that in terms of facts. We go back with facts, don't we? That's what we work to. We're intelligence-led. We're led by what the data is telling us. We're led by what the community is telling us. That's how we work. And we need to set the facts, don't we, and make sure that we're sharing those within our communities. So any opportunities that we get in, to have those conversations, we should be having those conversations. And the quarterly info that Kevin will share, and we'll put the link into the members' briefing, just kind of gives those figures on a quarterly basis. So actually, as elected members, you can be having those conversations with, within your communities with people to say, well, actually, that's not quite the case. And it's not challenging people, is it? But it's kind of, it's providing factual information, because you don't know where people are receiving that information from. So we've got a duty, haven't we, to make sure the information that people are receiving is right. And if it's not, and we know it's not, then challenging it. But yeah, I think it's an issue for us all.
Does that mean that we can try and get some information back out of the reporting system in terms of online reporting? Because that was the issue, really. Yeah. Saying to people, please report it online, and and they were taking.
Could I pick that up? Because we had a meeting with our local, I think, police sergeant, and also the police and crime commissioner, with a group of residents, and the concern that residents had was that yes, they do report things in, but we don't get the feedback about what's happened, and how can we and obviously the police, it's partly feeding information in as intelligence, so they know where things are going on, so they can, and recognising that sometimes, we report something in, and actually that leads them to an investigation, which again will be intelligence-led, and that goes on. So they kind of can't report that back, but there is some way about how do we get that feedback loop going so that people feel that if they're reporting stuff in, it really does come back to them?
Yeah, so I think what you're referring to. So it's not about an incident that's happened. You've got a crime reference number and you want feedback as a victim. It's about community issues that you know people might be reporting. It's brilliant we've reported it, but actually what action has been. It's that sort of feedback, isn't it? So. I think the lapse will help with some of that. It's the community voice, isn't it? That's what we're talking about, and it's two-way feedback, isn't it? It's us listening to the voices, and it shouldn't just be through the police's reporting portal. It should be, what are the issues in this neighbourhood, in this community? Community safety will be an issue in some of those neighbourhoods. In some of those neighbourhoods, it might be an issue, but it's less of an issue. There's other things that are more of a priority. So, I think as we develop that and we think about how voices kind of feed into the local area partnerships, I think it's something that we've got to consider. And I think it's. The police do the locally identified priorities, Kevin, don't they?
That's what I'm waiting to come in on.
Go on then, you go.
Every quarter I have a meeting with the sector inspectors. I just had them last week and the week before to look at what the community have identified as their locally identified priorities. And we've had a lot of effort in terms of trying to expand the number of responses we get, because they are increasing. And the sector inspector for Northampton had the HMIC come down and said, look, I've really increased the numbers in Northampton who are reporting about their locally identified priorities. And the HMIC had to burst her bubble by saying, so you've now got 1,600 reports from a population of 243,000. That's not good. That's woeful. And it has increased since, because anybody who signs up for Northamptonshire Talking is asked to complete the LIP survey. And there's the hope that that will actually then improve those numbers on a regular basis. So if you're signed up for Northamptonshire Talking, and if you're not, I want to know why not. If you're signed up for Northamptonshire Talking, that's a great series of feedback about what's going on in your patch, because you can target, you can tailor it. So it can be either the whole of West Northampton, or it could just be one ward, it could be one sort of crime, it can be every sort of crime. But then they will do the prompt. We are now asking what your local priorities are every quarter. And the numbers have improved, but we've gone to the Neighbourhood Watch, we've gone to the parish councils, we've got Alan in our team who acts as liaison with all the parish councils, and we're trying to get them, when you have a meeting every quarter, can we have your feedback and just prompt every member of the parish council even to complete that, to let us know what's going on.
So could we make sure that every councillor is signed up to Northampton Talking, do you think? Because we've got a new group of... So we could,
I don't know if we've done... Oh, sorry, I'm so bad, aren't I? It's because my drink's done.
I'm here, your secretary.
What we could do, again, is we could put something, couldn't we, in the elected members briefing, because we've got a lot of new elected members. Yeah, we can get something from the police, can't we, our police colleagues?
And also get them to identify who their neighbourhood PCSO is, because that's a key person for people to have a link with. Yeah. Now, I've got Rose...
It's actually a question for Jane, I think, really. Within housing, we were aware that it was very frustrating where you had members, residents and tenants who were basically terrorising their neighbourhood, often running drug deals and cuckooing and intimidation, etc. And we didn't have the ability to evict them. I wondered if MPH came into direct control, whether you think that situation could be improved.
So that's quite a hard question because, as everybody will know, the management of housing is a complex issue. The legal stipulations around tenancies and people holding tenancies is complex, and you can't just evict people. There's a very big process you have to go through. What I would say is that, through the move to bring them back in-house, and we still have to make a formal decision on that, we would hope that the alignment of services between ourselves and the work that Vicky and Kevin are doing and the work with our community safety partnerships will give us the opportunity to improve that and work as a collective much better on addressing some of that antisocial behaviour. Sometimes we get houses that have been sold on through right to buys where the antisocial behaviour is taking place and it's affecting our own social housing tenants. It's not always the tenants themselves. And it's very difficult when you have families that you have to house, they have to be housed somewhere. So it's a complex issue, but I would hope that that join up of services will allow us to improve that area.
Yes, I think we all know this. Certainly in the rural areas, we used to have a policeman per village. Now we have 4 for 31 villages. And there seems to be a reluctance, and I can't blame them, to get the police, one, to come and talk. When they come to talk, the village don't want to talk to them. And it's a breakdown in communication because people don't feel at ease about talking about their neighbour or their home situation. So what you're suggesting is absolutely great, but I think that the rules that you apply in the townships are totally different to the rules that apply in the country. I think that the tragedy is to remove the bobby on the beat in the rural areas, but there's not much we can do about it because we actually can't afford to keep it up. But therefore, what you do is, in fact, substituting what they used to do, but at arm's length. So how do we resolve it? You are aware, we're aware, and yet I'm appalled that when the policemen do come to the villages, one, half the time the village doesn't turn up, but also, and this is something that we may have to have a talk further down the line, Bob, is that the policemen who come are not fully equipped to answer the questions. And believe me, I've heard the same in Boddington, in Sulgrave, in Morton Pinckney, in Culworth, and up to Helmden. So I think it's a communication issue that perhaps the bobby on the beat or the substitute for the bobby on the beat needs to have better knowledge as well.
They're not coming to village annual meetings anymore.
No, they don't come to annual meetings. That's actually not fair. Sometimes they do, sometimes they don't. But when they do come, they're not equipped to answer questions.
Yeah, I pressed it then. Obviously, I don't want to, speak on their behalf, but it is something that I can absolutely take back and speak to Chief Inspector, just in terms of there's a recognition that actually it's sporadic when they're there, and when they are there, actually it's not the right person. And if that's not helpful, then I can feed that back.
I think the other thing to say is if you get individual instances, feed them back at the time, because then it's much easier for us to approach the police and make sure they're aware. So hopefully really helpful.
Yeah, two questions. The first one is to echo what Alison said. It's not just an issue in rural areas. I'm a ward councillor for Duston. Our PCSO covers 5 areas, 5 large areas, all going on to each other. So St James, which is probably, dare I say, more crime and fly tipping and whatnot there than in Duston. But they go through to Upton. So very diverse areas as well. And again, how do we get round, having the community coverage and the trust of our residents? Because I think very much so. I've spoken to the PCSO, I've spoken to the officers that cover Duston, and we've got some ex-police in Duston, so we're very, very fortunate ward. But it is how do we get that coverage? How do we build that trust? How do the residents feel involved there? So that was my first point going on from what we've just been talking about. And my second point is completely completely off of what we've been talking about, and it's to do with Pol Ed. I've spoken to a few schools and they've been really asking the question about the funding and the consistency, because they want to give the children in their school consistent citizen education, and they're a little bit scared that the funding may be pulled and then obviously the Pol Ed will go. And and it's not consistent with consistently educating the children. So how can we ensure that can be consistent? Because I've looked at the material and it's a great thing, and I do know that you've had the conference recently at the Guildhall about it to promote it. And thank you.
Yeah, I mean, it's currently funded through the Serious Violence Partnership, and with all central government funding at the moment, we're waiting, aren't we, for kind of autumn statement and to see what that looks like going forward. So I think there is absolutely, from the partnership's perspective, a commitment to it. So I think it will be prioritised, and the consistency is the really key thing, isn't it? You know, schools, we talk, don't we, about, you know, schools that we've got and academies and you know, kind of doing different things. Well, Pol Ed is a real opportunity to ensure that the message is a strong message and it's consistent across all of the schools. So it's definitely something that we as a partnership are, you know, invested in, and that's why I picked it out as my example. So we will aim to prioritise the funding around that, but we won't know more unless Kevin knows any more for another month or so.
First, and then I think we need to draw this bit of the agenda together, otherwise we'll be here all night and then we'll be inside.
Yeah, thank you, Chair. Quickly, Northamptonshire talking, I confess I hadn't heard about it and I will sign up. And please send details around to us, because we do reports to the parish council meetings, so we'll encourage them as well to try and sign up. In terms of the police reporting to parish councils and areas, I think it's more about acting smarter than them always having to be there. I mean, in my own area, in fact, funnily enough, I've just seen the apologies from our PCSO for one of the parish council meetings for Monday, but they always put in reports, which are always there, and most parish councils have a parish councillor who will be police liaison. So using those contacts perhaps more effectively is a better way than expecting, I think, a PCSO or police officer to come to every single meeting or come to a public meeting. And if we are having a public meeting, then I think it's important that we work together to make sure that they get the most value out of that. So they may not come with the answers because we haven't told them what the questions are likely to be. You know, there's things like that that I think will help. We need, you know, we know we have got limited resources, and you can't be dragging. I'd rather our police were often out doing stuff rather than coming to the 9. I've only got 9 parish councils, but 9 meetings that we have in our area. So just I think it's about making sure we act a bit smarter on it all, really.
Yeah. Councillor Furman.
So, thank you, Chair. I'd just like to say, first of all, I fully agree with Alison, by the way. We need people. We used to have, not a village policeman, because I live at East Hunsbury, but we used to have a fellow, I remember his name, Ron, funnily enough, that's how I remember him. And everyone knew him. He used to go around on a bike. I know all the PCSOs now, but they have such a vast area that they haven't got time to go around, and bless them. And they're not on every day, by the way. But I noticed with the schools, I was chatting to a young lady that visits the schools to do crime prevention, and she encourages them to use on their smartphones this app where they can report confidentially and totally hides their identity, so they can do it another way. And I say, by the way, Rosie, this is not a slant on you. WhatsApp have now just started, or will be starting this month, where you message Rosie and it comes up. I'm sorry. You message Rose, and it comes up. So it might be a help. What I'm trying to say, it might be a help, especially to the rural areas, is when crimes are coming up, or even with neighbours, if they could use that and someone could get the information and find out what's going on, you know?
It's exactly what Councillor Simpson said, isn't it, around, working smarter, working more efficiently. And we've got to find ways to do that, haven't we? And I do, earlier on I said about the labs. The labs are a solution-focused space to have these community issues. So, there is opportunity to have these kind of ongoing conversations, not just a, once a year conversation. But yeah, great idea.
Right. I think we ought to, I've got two final questions, if I could. One is just on the shoplifting issue, because certainly in my ward, which has a major shopping street in it, it has been a real problem for certain shops, particularly the supermarkets. And just to feel that we're actually getting on top of that as really quite an important issue, because it just demoralises, it's bad in every way, really, and it demoralises staff and it makes them fearful for coming to work, and it's just dreadful. There's just the question on the partnership itself, and I hear you saying it's working well. Are there ways that it could be improved? Are there things that we could do differently, or is it actually working fine and all the partners are fully engaged? So just
Aren't engaged. Again.
Yeah, I think the only area where there could be an improvement is probably the voluntary sector, but we've had conversations with Russ, certainly from Voluntary Impact, because he feels he can't represent everybody. So what we've done is put in sections on almost specialist areas, where we then invite the relevant voluntary sector partners to that area to try and improve that engagement. But it's because it's such a wide area and different people have different interests.
And it is really hard, isn't it? I think you said earlier, didn't you, about, we don't want people sitting at meetings for the sake of it. And it's about, isn't it, having the right people around the table at the right time. So, and with the community and voluntary sector, whose time is so precious, we don't want to waste that time. So although we don't have somebody regularly attending, we do work with the community and voluntary sector across our service area. We are very well engaged with them. It's just about one representative representing the community and voluntary sector, which is hard, isn't it, to do that?
And I'd say, Chair, that it's a question of comparing apples and apples. And we have had visitors from other police forces to see the way we do things. And even within Northamptonshire, the other part, some of the meetings that we run, for instance, the Community One meeting, which is led by Chief Inspector and Vicky, and various partners in terms of tasking and prioritising. My colleagues on the north are telling me theirs isn't nearly as effective and as well engaged with partners as ours is. So we can blow our trumpet a bit on that.
That's a nice way to finish.
Right, thank you very much. So, James, do we have any action points that we need to draw? And I suppose, do you have targets for the coming year? Or is there...
We do have key performance indicators. The three KPIs that we work for community safety, well, there's some for antisocial behaviour and some for crime figures, but the headline crime figures are the crime rate per 1,000 head of population. And that's what I draw that down from the Home Office when they update their website. And so those are two of our KPIs, and the other one is the violent crime rate. So those are our three headline targets.
James, any points you can draw out?
Thank you, Chair. So points that seem to come from the discussion from individual committee members, or possibly more than one, that the committee may want to translate as points from the committee as a whole. So I think there was a point about the importance of communicating with the public about different ways of reporting crime. There seemed to be encouragement from the committee of a community safety presence outside schools at home time. there was the point about more feedback being provided to members of the public on actions resulting from online reporting of crime. And then there was a point around consistent police engagement with local areas, if that captures the sense of what members were saying. And then more specific actions, so relating to the councillor briefing, there was the inclusion in that of a link to the quarterly CSP board updates, information on neighbourhood policing teams, and encouragement of councillors to sign up to Northamptonshire Talking. And then finally, there was a suggestion during discussion that an item might be included in the committee future work programme, I think, on work on community safety in relation to young people.
Great stuff. Right, I think we better move on because...
So sorry, just to be clear, so that was the things that the committee might agree,
yes.
or they might come back and say, no, you've got that completely wrong. Is the committee happy that that represents an accurate summary, and those are the things you want to agree as a result of that item?
We wouldn't dare contradict James.
James has spoken and it's said. Alison, come in.
I was just going to say go right ahead.
Yes, right.
It's a member-led process. We're merely here to assist you.
Yes, that's why I was asking you to assist us in that. Right, thank you. Shall we move on?
So thank you for allowing us to bring this to you. So the West Northamptonshire draft domestic, I'm saying draft because it's in very early stages, domestic abuse and sexual violence strategy is being reset at the moment. We already have a strategy in place, but we are looking to review that strategy based on needs assessment and make sure that we've got the right actions, the right priorities in place. So we wanted to bring it to the committee early, or to scrutiny committee early, so that you could review and work with us. Clearly we'll be looking to bring it back at different stages once we've done a bit more work on it, but we wanted to get your input very early on. Again, I'll let Vicky take you through the detail, but really that's why we're here, to ask for your support and input on it.
Yeah. So oh my gosh, it shouldn't be that hard, should it? So really early days, I think it's fair to say. But as Jane said, as we're kind of reviewing and setting this for the next 3 to 4 years, you know, it's a good opportunity, isn't it, for to kind of get feedback. So I think I pulled together some slides that's been circulated. Everybody's received those. Okay, great. So I suppose we've got, you know, we've kind of got as far as vision and setting our strategic objectives, and we've got a collaborative working group, a strategy delivery group, if you like, that we've set up. So just in terms of kind of governance around this, I suppose, and statute and where it sits. So every area is required to have a domestic abuse board. We've got a domestic abuse and sexual violence board. And ours feeds into the community safety partnership. So as I say, every area has to have one, and every area has to have a strategy. So whether we have to have one or not, we'd still do one because it's an absolute priority for us. But just so it's just to kind of set the context, and then the statutory partners, you know, very similar to the ones that Jane mentioned earlier, the local authority, the police, the health service, probation, housing providers, and we are working really closely with our community organisations as well around this. There's community and voluntary organisations that deliver support services to victim survivors of domestic abuse. So they are absolutely key, and they sit on our board. They sit on the domestic abuse and sexual violence board. So we had a strategic needs assessment carried out. So an independent consultant come and had a look, had various conversations with various organisations around how do we deal with domestic abuse victim survivors. You know, what are our processes? How do we tackle perpetrators? Looked at it in its entirety. So, you know, health, housing, community safety. What are we doing? So they have created a strategic needs assessment, and that's got a lot of information in it and a series of recommendations that are doing two things. So one, informing our commissioning, and hopefully most will be aware because we took a paper to Cabinet around recommissioning our domestic abuse services. So that's one thing that the needs assessment is feeding into, but it's also feeding into the strategy. So because the needs assessment is telling us what's good, what's working really well, and what isn't working so well, and where are our gaps. So it's focusing on both of those things. And what's really important to us, and this was covered in the strategic needs assessment, is that the strategy is informed not only by local data but survivors' voices and best practice. So we are really keen to ensure that we've got victim survivors kind of at the heart of our strategy and informing our our services, the way that we're commissioning our services. So a really important part of the strategy for us, that is. So we've listed the strategic objectives. They are really high level. Of course they are. As I said, we're early on the journey, and probably the interesting bit of any strategy is the action plan, isn't it? That's the bit that everyone gets excited about, because it's all right doing a strategy, and I've wrote so many of them. But actually, the really exciting bit is what you're going to do. You kind of set the strategic context, but actually, how are you going to make that happen? Who's going to be involved? So, I'm really sorry that we're not at that point to present you an exciting action plan. But we have with partners kind of picked off some kind of key strategic objectives, some areas that we want to focus on. So early intervention and prevention, that's kind of a corporate theme, isn't it, throughout the council in all of our service areas. It's better, isn't it, that we identify things earlier, that we get people the right support at the right time when they need it. So absolutely we'd expect that to be in there, wouldn't we? And actions that we might see under that will be some of the work that we might do with schools. So we've done some healthy relationship and consent workshops in schools. So that's the sort of thing, and I'm just trying to give you a flavour of what an action might look like under that objective. The second one is around support and protection for all victims and survivors. So this really, the main focus around this is making sure that the services that we're commissioning are fit for purpose, and they're culturally competent. We're talking about buy and force services. The buy and force services are services that are led, developed, delivered by people with lived experience, and as I said earlier, we are going through that recommissioning process for our safer accommodation. So we get funding from MHCLG for safer accommodation, and we're going through that recommissioning process. It's absolutely, our action plans need to focus around us being trauma informed, and ensuring we've got trauma informed training, and another action might be introducing survivor-led networks, regular networks. So again, they're not actions that are set in stone, but they are some of the things that we're thinking about and we're talking about, and it hopefully gives you an idea of what the objectives mean, what we're thinking about when we're talking about the objectives in this context. So trust and confidence, ensuring survivors feel safe. Again, really, it's really important, isn't it? The work the work that we would do around that. If we think about, kind of co-production of services, if we think about campaigns that we might do around kind of how to, where to get that support, where to report. That's the sort of thing that I suppose would be focusing on. It might be something else around ensuring that we've got a visible presence in the community. So, we've got a number of hubs, haven't we, kind of local and trusted settings in our communities, things like welcoming spaces, community centres, are the services that support victims and survivors of domestic abuse accessible in those spaces and places. So again, might be another action that we're looking at under trust and confidence. The other one, coordinated community response. So I think, that one speaks for itself, doesn't it? Hosting quarterly multi-agency case review panels, might be something that we would do under that. But it's about kind of collecting data and analysing that with partners. So it's kind of, a multi-agency approach to that response. And then the last one, holding perpetrators to account. So, making sure that we are safeguarding victims and we're taking appropriate action around perpetrators. So it could be strengthening programmes around restorative justice. It could be looking at enforcement around restraining orders and additional kind of sanctions that are available to us under the legislation. Last slide. You're looking at slides, but I am, that I sent out to you. So in terms of implementation and impact, as I said, we will have an action plan. I spoke through the governance arrangements. What I should have said at the beginning is this is a strategy across the north and the west. We've agreed that we've done this together as we did with the commissioning services. It's not right, is it, that people should have a postcode lottery around domestic abuse, and actually economies of scale around safer accommodation. It absolutely makes sense for us to do this together, and given our partners are serving both the north and the west. And obviously, as part of the development of the action plan, once the strategy is approved, there will be a performance framework around it. So we will have some performance indicators that we will measure ourselves. So we will measure, is the strategy impactful? Are we making a difference? And are we meeting, the performance indicators that we've kind of set out to achieve? So, Kev, have you got anything you want to add?
Just to say that in terms of the victim survivor, when we had the analysis working with partners, interviews of victim survivors was a very, very large part of that. And I was particularly pleased that the consultant had interviews with over 400 victim survivors, and meaningful face-to-face interviews. It wasn't just a question of surveys. It was an excellent piece of work, really in depth. So we'll get in, again, who have you reported to, why have you not reported, what were the barriers to reporting. So we very, very much got a victim survivor voice on that one as well.
Yes, so I noticed in your partnership you didn't mention housing, and that is a really key partner. And when, up till this last year, we had 3 different teams who weren't necessarily talking to one another. We had NPH had a team, we had the housing department had a team, and we had the community safety had a team. And obviously it makes sense that you're all working together. But one of the other things that really irked me was this assumption that and it's usually a woman, let's face it, who's fleeing rather than domestic. I know it happens the other way around, but in general, that it was the woman having to flee the home with the children, and the perpetrator stays put. And that can't be right. It's not right for unsettling the children or the mother, and for us, because it costs. Why should, and often the tenancy is in the man's name, and we've got to deal with that, because it's him that should be being shoved out the house, and the woman should be protected, and the family should be protected within the home. And we have a lot of technical stuff now that we can do to actually ensure safety within the home. With cameras and locks and et cetera, et cetera. So I think we should weave that in somewhere, that our assumption first should be what we can do to maintain them in the home.
That comes through really strongly, doesn't it, with the needs assessment, and something that we've spoken about regularly in the strategy working group. I literally couldn't agree anymore. It's 100% the priority. So the housing, our three main housing providers do sit on the Domestic Abuse and Sexual Violence Board, and they also sit on the Community Safety Partnership, and then at an operational level, those three teams that you mentioned, they all sit on the strategy group. So there is that join up. I didn't mention it, but it's absolutely there. And there's other partners that I haven't mentioned either. I would say the Domestic Abuse and Sexual Violence Board is probably one of the best attended, regularly attended boards, partnership boards that we've got, and it really does have the right partners around the table. So we'll absolutely continue to work with those partners, and absolutely, it's a priority for us for the victim survivor to remain in the home. Absolutely makes sense.
How many at the moment have we got in refuges or temporary accommodation?
We have got those figures.
Yeah, I mean, I haven't got them here, but we can share those figures. Obviously, we record, in terms of housing, we record everybody that comes to us for a domestic violence or abuse purpose. And we can obviously provide those figures for West Northamptonshire in terms of the housing element. One of the other things to say is that we are obviously working much closer with Vicky's team in terms of that preventative domestic abuse work with those partners as well, to make sure that we have a pathway through. And some of the learning from some of the domestic homicide reports that we've had has been around actually catching people indicators. So it might be that there's, for example, a rent, somebody's not paying rent, but that could be an indicator that there's something more going on, and the questions that we need to ask and have been built into that pathway are much more robust as well. But I'll get those figures for you for the last year.
So I think Alison and then Andrew.
Very briefly, we put this together 5 years ago. No, the beginning of the unitary.
One of the first strategies, wasn't it?
Right. My next question was, do you feel you've made progress? Would that be rude? Because there are quite a lot of people who don't feel you've made any progress whatsoever. And if you have, can you enumerate? If you haven't, what do you need to do?
Yeah. So do I think we've made progress? I don't. So I think it was really ambitious, that strategy, and the action plan was even more ambitious. It was one of the first strategies that we did. So this time around, certainly asked that that we are much clearer about a 1, 2, 3 year action plan on what we're going to deliver in each of those years, so we can hold ourselves to account and remain focused and targeted. I think we have made some good progress in some good areas. I think, some of the work that we do with schools around healthy relationships, some of the prevention stuff that we're doing around consent, and I suppose there's pockets of that. Have we strategically embedded that? I think there's probably more work to do around that, but I think we've done some bits absolutely. We've done some, we've trained housing officers. We've trained elected members. There was a session, wasn't there? I think we had about 30 elected members attend that session. Julie, our coordinator, is going to run another one early in the new year. Debbie and the team is trauma-informed and has been delivering trauma-informed across services entirely within WNC, but also offering that outside. So, and I could probably go on in some, in some of the tangible things that I'm thinking, what have we done? we're on the journey to commission the services, which is going to make a massive difference, which is really exciting, because actually, you know, soon we'll be receiving those tenders and really be able to see what's out there and you know, get some sustainable provision for a number of years, which will really help us, but also help the organisation that's providing it. So that's quite exciting. So, yeah, I think we've done some really good stuff. But I still think there's quite a lot more to do, and elements of that. I think, you know, if you look at the current strategy and the new strategy, you can see what's been taken over. So the stuff that we haven't quite done, and if it's still relevant, it's been fed into the new strategy, because I think, you know, it's important that we do that. That was what we did first, didn't we, Kevin? The working group did a bit of a reflect. So, yeah.
Sorry, I didn't mean to be rude and make you go through it. It's just that sometimes if you see the picture in the whole, it's easier for us to comprehend.
Andrew and then Hayley.
Yeah, thank you, Chair. Bearing in mind where we were seeing the figures earlier for violence and domestic violence, 41% I think in South Northampton, Daventry, and 38% in Northampton, it shows how important it is to have this in place, and really welcome it. I'll be honest, and being a newbie and not knowing about what happened before, I looked at it and thought, this is a bit light, it seemed not much in it. But you've now explained the context of that it's the start of the process, so I feel a little bit more confident about it. And you know, there's nothing to disagree in here. I think it seems to be logical, sets out exactly the areas that you'd be wanting to focus on. I guess my question is really, when is the action plan going to come out? What date are we looking at for that? And Chair, would that be something that we as a scrutiny committee would look at? Because I think that would be quite a useful thing to do. Because as you say, that's the important thing, really. You can put some words in a PowerPoint, but it's the action plan that we want to get to.
So happy to share the action plan with you. So we are looking. Are we December cabinet for the strategy?
Yeah, but the team have been taken up both in West and North with the commissioning process first and foremost, because that's one of the most significant things that we're doing. It's a massive amount of money that we need to get into a commissioning process, which has been very, very difficult in terms of getting everything aligned. And for a long time, our colleagues on the North were saying that they didn't want to move to it. I think it was in a too difficult pile. But some changes in personnel mean that we've now got them on board, and so their money is in the pot too. So it's going to be a much better service, but it's a huge piece of work. So Julie Taylor, who's the officer who's leading on this, has been very, very busy with that side of things. But our colleagues in the North have started to pick up the development of the strategy, because we're doing the commissioning side of things. So I think December is not unreasonable.
So if it's adopted in December, I think, you know, it's reasonable. A month is probably long enough for the development of the action plan, because actually a lot of the actions, you know, it's also not like nobody's doing anything either, is it? You know, in terms of, you know, one strategy, you kind of, you know, refreshing and reviewing the strategy, and things don't stop, do they? It's a bit like, I've had similar conversations around the local area partnerships, you know, actually they're meetings. You know, there's still a team that are doing stuff on the ground. So some of the actions will just be kind of carried over, but we do want a real partnership reset on those, don't we? And ensure they are partnership actions and they're not just our actions, because that's what happens, isn't it? There are lots of strategies that we're responsible for. They're partnership strategies, but you know, you want to develop them in a partnership way, don't you? With community voice as well, victim survivor voice. So I think December is our aim. Don't hold us solely to it, but I think you can expect to see an action plan, you know, early in the new year, and we'll be more than happy to bring it back to the group.
And in terms of what Vicky was saying about things moving on, for instance, going back to Rosie's point about target hardening and making homes safe, there's already been 2 meetings with police and our colleagues in the North about the funding that we all put into target hardening. But I've also pulled that in from NPH and Futures and Grand Union about what money do you put into it, and do you just do it for yourself, and is it linked up? So trying to pool those resources so that it's more efficient. And that's one aspect of the commissioning contract, which is some work in terms of coordinating the journey for the individual victim about who they go to get all their services, and it's consistent across, rather than it depends on who your landlord is. So that's a piece of work that's already taking place, not complete yet, but getting people to change their practice is often the hard bit, and a lot of the progress is about getting people into a position where they realise things have to change, and that they're at the table having those conversations with other partners. Sometimes that shift in inertia is it's like pushing a car. Getting the wheels rolling is a bit hard bit. Keeping it going after that is a lot less effort.
Thank you, Chair. Just a question, really, in terms of the action plan, and obviously prevention, early intervention, running through everything we're discussing and doing. Basically, are we sort of thinking about online messages? We're talking about adults here, but it comes into that talking to schools, obviously kids probably shouldn't say kids, young adults when they're 18, they're still in the sixth form, because obviously there's a worrying trend with the sort of Andrew Tate and the young lads from all cultures thinking it's pretty cool to treat females or other genders less so than themselves, which is a worrying trend coming forward. So can we sort of, meet youngsters where they're at with some sort of influence on social media?
It's so challenging, isn't it? But yeah, absolutely, it's got to, hasn't it? It's got to include that, and some of the projects that we mentioned earlier, where we've been working with the community and voluntary sector and PolEd, in terms of going into schools, we've done additional stuff in, I wouldn't say targeted schools, but in terms of schools where we've identified, that there might be a need, working with community and voluntary organisations around consent and healthy relationships, and what does a healthy relationship look like, and there's that kind of at primary school level, but then there's that those kind of conversation developed, isn't it, as you get into secondary school. So really important as part of our early intervention and prevention work, and I think it isn't just schools either, is it? It's youth settings. It's wider, isn't it, than just kind of our mainstream schools. But I think definitely we want actions like that in the plan, a commitment from partners to support us with some of that, and I think we've got to do that, haven't we?
Thank you. Yes, I mean I suppose one in I think Kevin's report there was something about serious case reviews. That many of those involve relationship violence.
The domestic homicide review.
Yes, those seem to have some pretty scary, probably have some pretty scary conclusions in them, and things where we've got it wrong as agencies. Is all violent crime preventable? And should we be doing that, really? And so that agencies really are cued to pick up early signs of problems. And how do we challenge some social norms that we have, which is really Haley's point about, how do we challenge the normal attitudes that are actually contributing to this, to violent relationships. And and I suppose it starts with us as councillors in what we say and how we go about things. It's officers and the way they go about things. It's our partner agencies. And if we could just change attitude, I think there are attitudes that need changing. And I think it's people, probably my generation, who need to start to do that. So, you know, how do we get that into the system, really, is my challenge to the strategy. Don't need an answer now, but that's...
I was just going to say, one of the things we'll consider as part of the strategy is how we run things through, embed it within our services, both operationally and in policy and practice. But the main part of this is leadership. The leadership has to come from every single one of us in this room. It has to come from the people that we put on the ground that are dealing with this. But what we need to do is also engage those community leaders who give the messages. You know, in different areas, different communities, different cultures, there's different practices and approaches. We know that domestic abuse is generational. So where people see it and experience it, it can be trauma related. So it's really, that prevention work has to be running through everything, but we have to show leadership.
Yeah, and the other point I kind of was that the people who most need the advice and the information are probably the ones who find it most difficult to access it. And how do we get that? How do we make sure that it is those people who are most vulnerable who have got the information?
Yeah, I mean, again, it's a really good question around how do we get feed-in and those hardest to reach. And one of the things that we do find is that the police reporting represents one part of it, but actually the numbers we have coming through housing is quite different, and they're not necessarily people that are reporting. So there are different avenues in different places where people turn up and different indicators that can tell you that somebody is having an issue, whether it be debt and money, whether it be something else. So we just need to keep that training education with people that are on the front line.
And in other areas, the local authority has been talking about how we use AI to pick up early indicators. Is that something that is on your horizon?
Yes, so one of the projects that we've just taken on and are just about to move into is something called Zantura, which is exactly that. It's a predictive analytic tool, and so we're just trialling it. It's been used by Medway in Kent, and they've had really good results around homelessness, but it also can predict other issues that are coming up and leading to it. So Vicky will be recruiting 2 people through the Homeless Prevention Grant that will help us work on that and start to target some of those people early and deal with some of those issues. Hopefully it should also bring through some of those where there's early domestic abuse issues, where they haven't been reported, where they haven't been picked up, and that will come through. But again, we can give you some, as we start to work through that progress, perhaps at 6-monthly intervals, we can perhaps bring you some of the data from that predictive analytics and just show you how that's working.
Right, so it's been I hope it's been a useful discussion in terms of, I don't know, probably things you've already heard before, but it's what's our role as a committee in terms of supporting this strategy developing, I suppose is a question to you.
So you can add on after this. I mean, I think that there's a number of things. So as we are developing the strategy and the actions, I think it's bringing them in and getting that input from you to make sure that we are thinking about what you see as members in the community, about what feedback you get. Again, that first conversation on the statistics was really helpful. So when we've got more information for you, it's that. Again, with some of the testing that we're doing, so with something like the predictive analytics, again, if we can bring you in early figures, suggestions as to what we might want to look at, things we might want to consider would also be really helpful. So I think it's an ongoing conversation with you at different points about this is the stage we've got to, this is what we're thinking. Does that sound right to you? Is there something else we need to consider? Would be really helpful to us. Sorry.
No, I've just been reflecting and thinking about the question asked and around, you know, in terms of the strategy, what have we done? What haven't we done? And actually, as we're rewriting the strategy, I think we need to encompass that in the new strategy, don't we? To be really clear about this is, you know, this is what we said we were going to do. Actually, this is what we've done. I think we need to reflect that in the strategy. But yeah, I mean, happy to come back, you know, at regular intervals. There is so much going on in the community safety space. I could do a whole session just on antisocial behaviour and the stuff that's going on. We could do a session on young people. Could do a session on knife crime. Like there's so much stuff happening and around community safety that we could talk for days. So, you know.
What we're trying to do as a committee, whether we're succeeding or not, is to kind of theme our meetings so that we kind of do a health session and an adult services, and then and tonight's a community safety session. So I think that if that works, then we'll kind of stick with that, and we can, you know, and hopefully just doing two topics a night so that we don't. You can try and spread yourself too thinly. So just do two topics. I mean, because LAPS falls in your area as well, and we've got that's quite a big issue for us as an area that we're very interested in, and how that relates to the health changes, and how I suppose we bring the community safety prevention work and the health prevention work together, and the opportunities that we've got through the changes in the way the health service is going to be operating, and to actually have those conversations perhaps with the health people, just so there's some real joined up, I don't know whether we can get joined up thinking, but at least an understanding of the different agendas that we've got and how they relate together. So yes, that would be very welcome. And there's more than that. I suppose it's a question of us really prioritising where we as a scrutiny committee can add value to the process. That's what we've got to do. Kind of giving us information is kind of neither here nor there, but can we actually make a contribution to the development of the work that the kind of partners are involved in? So, at which point, I think, are there any other points anyone wants to make, or is this the moment for me to draw this section of the agenda to a conclusion? And thank you very much. I don't know that we actually formally received the annual community safety report. We probably ought to do that and welcome the report in it. Does it need to go anywhere from us? Does it go? Are we the receptacle of that report? Though I do think actually all councillors should read it. Actually, probably. Put the link into the into the thing.
So you know we said the quarterly link, so that will form part of that link.
Yes. So thank you very much for your input to that. And in terms of the domestic violence strategy, so what is? How do we, James, help us come to a? Have we any conclusions from that?
Well, the tone of the discussion, Chair, seemed to be generally positive and supportive of the direction being taken, so I don't know if that translates into a resolution by the committee that endorses the direction being taken on the domestic violence strategy. I think the offer was made for further scrutiny of this topic, and you quite rightly highlighted that committee will need to give consideration to where it can add, what it can do that can add most value, but it sounds as if the committee would agree to including future scrutiny of the domestic violence strategy as it develops in it and is implemented in its work programme.
And we welcome that back. And we've certainly got a meeting on the 20th of January. Would that be about right for you, or a bit later than that?
Can we talk outside?
Yes. Okay. Yeah. Okay.
On the rest of the plan, and then
right.
Give you a date. Is that okay?
Yes, that's fine. Right. So can I thank you for your contribution and let you go home? We need to talk about the work programme. James, help us with the work programme.
Yes.
Yeah.
Prioritisation toolkit first, Chair.
Yes.
Although the two are related.
Yes.
So item 7 on the agenda, the scrutiny prioritisation toolkit. This, in a nutshell, is intended to be an addition to the tools available to overview and scrutiny to help it use its resources to best effect. So this stemmed from a point raised by Councillor Hayes, who's the chairman of the Democracy and Standards Committee, about the scope for scrutiny to take a more systematic approach to prioritising topics once they're in the work programme. So the overview and scrutiny framework that West Northamptonshire Council already has gives attention to how a topic goes from an idea to getting into a scrutiny committee work programme, the forms that members will know of. But as I say, the suggestion was raised, well, once you have ideas that are agreed to go into a scrutiny committee work programme, you might have several good ideas, good topics to scrutinise. How does scrutiny go about deciding which to do in which order, which is more important? So Democratic Services did a piece of work on that, which took account of, as is usually the case, good practice elsewhere that we might incorporate in what we do, and that produced the paper that is included with the agenda today. This is very much intended to focus on in-depth scrutiny reviews. So the really major pieces of work that committees can do outside of its formal meetings. One of those can involve committing to spend, anything up to 6 months looking at a topic. It's absolutely important there that scrutiny committees make the right choice about what to do, how to do it. So the process before you tonight, it's intended to be a two-phased approach that could be used to prioritise between different topics where necessary. This would come into its own when a scrutiny committee has got several potential topics for in-depth pieces of work in its work programme. This is intended to be a process to help it decide which order to do them, essentially. So this was presented to the Scrutiny Triangulation Group at the start of September. For members who aren't aware, the Scrutiny Triangulation Group is a meeting involving the chairs and deputy chairs of each of the 3 overview and scrutiny committees, the cabinet members and the council's senior management team. So presented to the triangulation group, which agreed that it should be implemented, and the effectiveness of it would then be reviewed at the start of 2026. So this isn't intended to be prescriptive. It's intended to assist scrutiny where the need arises, and as I say, that would be a situation where a scrutiny committee has in its work programme several task and finish reviews that it might do and needs an objective, an evidence-based way of deciding how to prioritise between them. Happy to take any questions, Chair.
I hope Bob and James are going to do it. And we'll abide by whatever you say.
So, yes, Chair. I mean that's a point that's been raised at the triangulation group. Well, who decides the prioritisation? There was a suggestion that, well, does each committee need to have an expert, a lead member who would lead on that? And I think, yes, the exact answer is, well, logically that would be the chair and the vice chair, and with some support from Democratic Services.
Yes. Alison.
Just to add to that, at the end of last year, there were a series of us who actually went on a really good scrutiny induction course. And it was suggested that when we came back, that in May, that as well as something like this, that we would also go on another similar activity, because sometimes practical application is better than looking at a sheet of paper with a whole lot of ideas on it. And I have to tell you, Fiona, Cole and I came away much the wiser. So has that now been ruled out?
No, I think the Council Democratic Services would be open-minded about the opportunity to learn from counterparts elsewhere. I mean, as we know, everything there is anything that has resource implications that needs to be considered. But no, there's a lot of activity that comes from the Centre for Governance and Scrutiny, for example, which is absolutely about opportunities to see who does what elsewhere, what we might learn from, and what reinforces that we're actually doing well.
In fact, Richard was on the same course.
Andrew.
Yeah, thank you, Chair. Just I think it's excellent to have this framework to go through, and obviously we've got stuff we've identified which we now need to put through this. Did I read it correctly? In could this be used by any councillor to put forward an item to scrutiny, in the sense that they could fill this form out and give it to the chair, the relevant chair, and go, you know, this is an item that I passionately care about. Because it does say could be one ward, so it might be a ward.
Absolutely, and in fact there is on the website a form for you to fill in, which is really useful. And actually, that's how it should work. Actually, you know that.
For analysing it, if you've got 10 forms, and then you'd have to decide
to prioritise it. Yeah, I get the prioritisation bit. I just was wondering whether this would be something that you would use as well.
So, as the chair has said, there is a specific form for councillors to use to suggest a topic for a scrutiny review. So you wouldn't use this, but you might have this in mind because, for example, if there was something which a councillor was proposing should be scrutinised, and that was particularly time limited, say, you know, if it's not done immediately, then there's no point doing it, then that could be something that brought out in the proposal.
Hey, come in.
Thank you, Chair. I think it's also we have to look at the impact that each topic that we scrutinise is going to have, the impact, and also in terms of when we make our recommendations to Cabinet and to officers, you know, how sort of realistic it is to bring change. Because some issues, West Northampton Council and us as a scrutiny committee are not going to make recommendations to change anything, and that's something we have to consider in all of everything we scrutinise. My question was, James, with the task and finish groups, can we have more than one? It seems, and I may have got this wrong, can we have more than one running at the same time? And obviously, roughly, and I know this can change, how many councillors would be in each one, please?
Okay. Yes, you can have more than one task and finish group running at a time, although the ideal is that you don't have several of them at exactly the same stage. So you might have one, if you have one that is in the midst of a scrutiny review, the most intensive information gathering stage, then you might have others that were just starting or just finishing. You're not having several that are all at the most intense stage at the same time. And the ideal number for of councillors to be involved in task and finish group is somewhere between 5 and 7. Any less than that, and it starts to get a bit not broad enough based. Any more than that, and it starts to get a bit unwieldy. But it's horses for courses. You know, what are you looking to do? What's the best way of doing it? But yeah, between 5 and 7 as a rule of thumb.
Excellent. Is it useful for me to feed back kind of some of the topics that were coming up at the triangulation meeting, particularly in terms of topics that go across 2 groups, and the kind of areas were the transition from children's services to adult services is something we could well look at. There's something about, I don't know whether there's a bee in my bonnet, but in which case put me back in my box if I need to be. But I think the issue of the adult services budget and how that works and the difficulty of predicting that and really having a real grasp of what and really, when we look at the budget, we tend to do it for next year. I wonder whether we almost need to be looking 2-3 years ahead to really understand what are the issues, what are the pressures, and are there any ways of dealing with that. Can I go through my list? And then, yeah. And then there's this area of prevention, what we mean by prevention. And can we do we need to look at laps and hubs and bring that all together so that we've got a real kind of grip on how does the council do prevention work? And we had a discussion at the Cabinet last night about the changes in the health service, and the proposal, the paper that came to Cabinet last night, which I was unhappy with, I have to say, was that the laps go from 9 to 6 or to 5. And I'm actually bothered about that, because I think we lose the granularity. Now, the view was that the health services will come down to 5 service areas, and so we need to be lined up with that. But I'm struggling with this thing about as that might be good for operational reasons, but in terms of understanding our local communities and making sure our local communities and local councillors feed into the process, I think we need to keep it local. So I'm sort of struggling. So that's a kind of prevention hubs and laps area of work for us to look at. Rosie, come in and save me from...
Well, I actually, mentioning the Cabinet paper, the one thing I was really thrilled about was that there was a suggestion of giving them a budget, and James will know that that's something I've advocated for ever since they were set up, because it seemed ludicrous to me to not actually give them even a small budget to actually do something with them and make a change. But the other thing was really sort of adding to what you were saying, is this need for horizon scanning, even if we do it on an informal basis, but there's going to be changes in government, there's going to be changes in policies coming forward that we need to be cognizant of, which are going to affect the council. So it was that area that I think is still an important area to look at, even if we do it maybe as more of an informal workshop session rather than a formal meeting.
We did talk about that at the triangulation meeting, and I think the view was that actually across the scrutiny, it was a task for the triangulation group also to do, to really kind of cross-party, just to look further ahead at what are the issues that are coming. So yes, and I think then to bring that back to our committee as well would be a useful thing to do. Andrew.
Yeah, Chair, I'd 100% support your proposal about looking at the budget planning and trying to get ahead of the game, because it seems to me every year we're being told that the council's got a shortfall in funding, and it's being driven by children's services and adult social care. And there's lots of people who are very clever. Why do we never get ahead of that and work out how much money we're actually going to need for the future? I know there's some of that being done, but I think it'd be good to understand that, because it's something that you have to try and explain on the doorstep as well. And I think we talked about that when we had that planning meeting.
Yes.
And I was looking through the work programme to hopefully see that. I wasn't quite sure it was there. Yeah. So I
wonder whether we do. I don't know how we actually set up a task and finish group to sort of start to look at that issue, because I think it's a difficult one, I think, James, I've asked you a question, then waffled on. So
yes, and Councillor Herring has jumped in with precisely the point I was going to make, which is you also need to be conscious of the place and resources scrutiny committee and the budget scrutiny process. I don't know what areas they've chosen. They may not have chosen them yet. When in terms of scrutinising the draft budget for 26-27, this could possibly be one of them.
What I'm suggesting is actually that we will get involved in this year's budget process anyway, but actually a longer term thing, really aiming for some recommendations for 27, 28 almost, because I'm in my head, I kind of think, whatever we say, the budget's almost put to bed now. You know, if we're going to make any difference, it's going to be 18 months ahead.
Would you be talking, Chair, about how the council horizon scans and identifies in the long term likely future demands on adult social care?
Yes, and its budgetary implications.
Yes.
Yes.
Sorry, Joe.
Having served on a lapse committee, as we all did last year, I think the biggest detriment to all of us, as Rosie has said, was budget, because there wasn't one. And the other thing is the determination of the lap was entirely due to the chair, in many ways, of the person that ran it.
Yeah.
Ours was a disaster and a nightmare, but also the person who, under Matt Gilby, it was tight and productive.
Yeah.
So I think the first meeting we had here, we touched on the laps and what we were going to do with them, what would be the potential and the future. I'm not saying they should be ruled out, but I think last year they were given too much importance.
Well, I think because of the changes in the health structures, there's going to be a real focus on LAPs, local area partnerships. And as I understand it, there is within health, that there will be budgets devolved to those service areas. So that really has very significant opportunity. Absolutely. And I think we need to be involved in, I was having I had a meeting with Chief Exec this morning, and we were talking about that health operates in a very different model to local authorities. They're very centralised, very prescriptive, whereas we are allegedly more democratic and more community-based. And it's the question of, can we get those two to meet in the middle so that services really do meet the needs of their local areas? And can we really create that sort of partnership? And it may be that we could, actually, but it's how is that process set up, and can we as a scrutiny group actually help that process in terms of our role of convening people? So can we bring the different partners together so that they kind of see that, and what is the best mechanism for doing that? And whether we just start off by just having one of our meetings to bring all the partners together into this room and seeing and having that kind of conversation and actually sorting out when the best time is to do that. I don't know what people feel about that as a useful activity for one of our fairly soon meetings, actually. And I'm talking to the new Director of People, I think she's called, Melanie Williams, yes, soon. And I wonder whether that is something that we could...
What's her name?
Melanie Williams. Yes, Chair, that would seem to be a very logical conversation to have that could help to inform what the committee might do.
Right, so I think we're probably needing to go home on the one hand, but also have we got a work programme, James, is more important, because our task is as a committee is to come up with a bit of a work programme, isn't it?
Yes. So, firstly, just for the sake of the record, I take it that the committee is happy to note the prioritisation toolkit. I can't even say it right. And yes, I mean, on the work programme, the saving grace on this is that the work programme is always evolving. It's never fixed. It never can't be changed. So you are where you need to be in terms of having something, but you also have the opportunity to add to that, to change it, to move things around as you see the need. And part of seeing the need will be as you get more familiar with your role, as you you engage with the new executive director. There's ample scope for it to be modified as you progress.
Right, I've cut across Rosie, who was trying to say.
Well, actually, it was a sort of any other business, really. Yeah. So I don't know whether you want to conclude that bit first.
Right, I'm conscious that we have a meeting in not many weeks' time, like the something of November, don't we? Yes, 24th of November, which is going to come up very fast. Have we?
So the items in the work programme currently listed for that are the outcomes of the Care Quality Commission inspection of the Council's adult social care function. Absolutely an important issue. The thing with that is going to be the timing of the inspection outcomes being known. So I could see the potential for that possibly needing to change. Then there's an item on adult social care workforce planning and an item on adult social care performance, which I think was essentially intended to be a discussion with the cabinet member about her view on performance. So if those three items all went ahead, that would make a substantial meeting. If the CQC item changed, then the other two items would probably make a substantial enough meeting by itself.
You're suggesting putting an item on of the lapse on the agenda as well, aren't you?
Yes.
Not for the next meeting necessarily, but into the work programme, or would it be too soon for the next meeting? Because I think it's a good point. Yeah. But I think he's sort of suggesting that how do they get going as part of the task.
I've got a date in the diary to meet the director of whatever people, and these terms, and whether if you could, could you leave me to sort of negotiate with her and see what